Welcome to the Pulsating Biology, and in today's video we are going to cover a very short topic regarding AIDS and what are the questions that basically comes in your paper regarding AIDS. First and the foremost question is that what does AIDS stands for? So AIDS stands for Acquired Immunodeficiency Syndrome. The most common mistake that students make is that they term acquired immunodeficiency disease. This is not a disease. From the S, we say that it is a syndrome. So AIDS stands for acquired immunodeficiency disease. What is the pathogen of disease? We have already discussed earlier so many times that what is meant by the term pathogen. Pathogen are basically those causative agents of the certain disease. So when you talk about AIDS, the pathogen of AIDS is termed as the HIV. HIV is a virus that basically causes majorly AIDS. The term HIV stands for human immunodeficiency virus. So the virus that is concerned with the human immunodeficiency, that is termed as the HIV virus, which is a pathogen. It is neither a bacteria or not a parasite. It is a virus that is on the borderline of living and the non-living organisms. So the pathogen of AIDS is virus. Let's discuss about how the AIDS can be transferred or be transmitted from one person to another, and is it transmissible disease or is it not a transmissible disease? Now, since we have discussed it earlier that AIDS is a transmissible disease. Transmissible disease is a disease that can be transmitted from one person to another, and one infected person can cause an uninfected person that disease. Let's learn about what are the methods of transmission and how AIDS, the disease, can be transmitted from one person to another. The first and the foremost is the sexual contact or the sexual intercourse. AIDS is a kind of a disease that can be transmitted through this. Secondly, we can say the sharing of the needles. Whenever we go beyond the unhygienic substances, we say that the one of the foremost is the sharing of needles that can cause AIDS. For suppose in a barber shop, if a person goes, or even in a hospital where the tests are basically taking place, so if an uninfected person comes there and is injected by the same needle that was injected to an infected person, basically that can cause AIDS to that person if the infected person had AIDS. Thirdly, we can say by the blood transfusion. As I've given you an example, if the blood is transfused in the hospital from the person who is uninfected to the person who is infected, that is known as the transfusion of the AIDS. Other one is that the mother to the fetus. When a baby is present in the mother's womb, that can be a major transmissible factor for the AIDS. We can say this is majorly through the placenta. Fourthly, fifthly, we can say that the mother to the infant also. How once the baby is born, it can also be transmitted into the infant where the breast milk. The breastfeeding can cause the AIDS if it is present in the mother to the baby. So these are the few methods of the transmission. The sexual intercourse, the sharing of the needles, the blood transfusion, from the mother to the fetus through placenta, from the mother to the infant from breast milk. As if AIDS is a very common disease that can be transmitted very easily, and these are the few major factors that basically can cause the transmission of the AIDS. Here we are done with the topic AIDS. If you have any questions, you can ask in the comment section below. Thank you for watching.